So yeah, the OET is a B or more in all the areas. One exception is Manitoba is accepting IELTS general, which most of the others do not accept. And some of the provinces might have some other exemptions or exceptions if you come from certain countries. But overall, you will need to have an English proficiency test. And despite me repeating this a million times, every time there's a deadline, someone comes to me and says, can I apply without the English proficiency test and give it later? Usually the answer is no. So these tests are valid for 2 years. You're just going to have to take it every 2 years until you get your license. And just the earlier you accept that and you prepare for that and you have that ready, because you can miss out on opportunities when they come. So for example, a lot of people have been waiting for PACE in Nova Scotia. They just opened. They have only 2 weeks window of application. And I kid you not, my Instagram is flooded of people saying, I didn't know, I didn't take my English proficiency test. Well, I've been saying since forever, you need all 4. If you already have the knowledge and the proficiency, take the exam and get that cleared, get that box checked, because it will come after you later if you do not have the English proficiency test. Okay? So that is the one thing that is like easy for us to discuss, is that the currency of practice piece, it depends on what pathway you're going to do, what province you're going, if you're applying for a clinical assistant or associate physician, or if you're applying for a CaRMS. But overall, after studying all these pathways, I can tell you that, except for a few situations like Alberta, if you have practiced 6 months in the last 3 years, you're usually considered current of practice. Alberta is a little bit stricter. You have to have practiced 1 year in the last 1 year in the last 3 years to be current of practice. But for most of the other provinces and programs, if you practice 6 months in the last 3 years, that tends to be considered current of practice. A question I get a lot is, does it have to be continuous practice? No. Usually you can do interrupted practice as long as it's in the last 3 years. It does have to be either postgraduate training or independent practice. Now, here's a little bit of a difference. If you're applying for licensure, so let's say clinical assistant or CaRMS, you can count postgraduate training or independent practice. So if you just finished residency, for example, you finished in the last 2 years, you can use that. You're still current of practice. Like you can say that you practice, let's say you finished residency and you've been out of practice for 2 years, and before that you were full-time. You can say that in the last 3 years, you have 1 year of current of practice, because it was the last year of residency, for example, or last year of internship. If you're applying for a practice-ready assessment, they usually require that the recency of practice be the independent practice. Okay, so I have had situations where people practice, for example, they did 1 year of internship and then they practiced independently for 3 years, and now they want to do a second year of internship to complete the 2-year requirement for some provinces. Alberta recently changed their process. I found that out this week, but usually some of the provinces ask 2 years of
again, it's the same thing.
Postgraduate training. Then they do that after the second year. Then you'll probably be considered current of practice. But you need to see that for some situations, it might ask that the currency of practice be independent practice. Most of the situations will accept that the recent practice be either postgraduate training or independent practice, but it has to be a full-time postgraduate training, has to be official, so like accredited postgraduate medical education institution with an accredited body, such as a university or a federal government hospital, etc. Okay? Okay, so currency of practice, we'll leave it at that. I can tell you one thing, that when I do one-on-one consultations, which I have done less and less because I don't have a lot of time left, but what I can tell you is that I can come up with a plan for everything else. I can't come up with a plan for you to break your gap. It's really hard to break the gap in Canada. There are some options, but usually if you've been out of practice for 3 or more years, you kind of need to reflect in your moment of life where you are and how you're going to be the only one to be able to put in a scale how hard it is to go back home for 6 months and break your gap, or maybe not be able to continue as an independent practicing physician and have to look for alternative routes. Because sometimes it's very difficult. I'm not saying it's impossible again, but it becomes extremely hard after 3 years. And after 5 to 7 years out of practice, almost, I won't say impossible, but like even harder after 5, 7 years, because getting into residency, getting a position as a clinical assistant, associate physician, everything that can kind of put you back on track becomes harder if you're out of practice. So my number 1, 2, and 3 rule is always to try to not be out of practice. That's why I'm now even trying to do, this afternoon I'm doing a session online for people that are not even in Canada, because I'm trying to prevent this from happening. Preparing as much as you can before coming here so that you decrease the chances of being out of practice. If you are out of practice already for more than 3 to 5 years, my number 1 tip is to see what you can do to break your gap. Okay, because I think that is the one thing that will help you the most. Okay, so we addressed the M and the G. For immigration, I just want to briefly talk about that. I'm not an immigration consultant, so everything that I say, take with a grain of salt and do your background research or hire an immigration consultant. But I've also seen a lot of people that keep waiting to enter the pool. And then when the cutoff drops, they miss out on opportunities. So I have a recent example of a fellow that is at my hospital working, and she's a fellow. She has everything. She has eligibility. She's done a year of fellow in the past, went back home to India, came again. Now she's my fellow, not mine, at the specialty that I'm the director of. And she was like, oh, I'm going to wait until I finish the second year of fellowship to enter the express entry because I'm going to get another 50 points. Because according to her, like when she went on the simulator that you can do for express entry, she was short like 30 or 40 points. And I told her, no, you're going to go into the express entry pool now. And if you don't make the cutoff a year from now, you add the new information and you will up your points. She did that. So she went, got her English proficiency, everything, did that. And on the next round, less than a month later, it dropped 40 points and she got invited. So by the time she finishes her fellowship, she'll be ready to apply for jobs now because she has the PR eligibility. She passed the written exam on the Royal College this year as well. And she has now the PR. So now she can actually look for jobs starting like in 6 months. So it is a long-term plan, and you need to plan way ahead. The PR after you get invited takes 6 months to a year, and you don't want to be waiting because you become out of practice again. So that's the thing that you need to start all these things at the same time so that they kind of come together in the end. Okay, so if you do not have PR or citizenship, my suggestion is that you go on the immigration website. It's called CRS calculator. I don't know what it stands for. I don't know, CRS is something score. And then you calculate your score. If you are like above 420, 430, just get in the pool. The last cutoff, I think, was 460 something or 470, has been going up and down. And it's unpredictable when they're going to call and what the cutoff is going to be. If you do not have the maximum score in English proficiency, my suggestion is always to study more, and when you feel ready, retake your English proficiency exam, because that's the only thing that you can actually do to increase your points. It's really hard to increase your points in education. Your age is a big one. So the younger you are, if you're back home, that's why it's also important to apply, because every year you go down on the number of points you get. Okay? So now that we covered 3 out of the 4 on the framework, we can talk about medical licensure. Okay? So the first group of people that I usually address are those that completed medical school in a 4-year program or a 5-year program with no internship, did not do any residency, and never practiced, and did not do any residency. So that alone, so you did a 4 or 5 year program and or never practiced. But mostly I'm talking about the people who didn't do internship or residency. So for example, you went to the Caribbean or Australia or New Zealand, you got your medical degree, you're back in Canada. For these people, you have no other option. Your option is to apply for CaRMS. So you need to set your mind that CaRMS is your only option and focus on how to get into CaRMS. Aside, that's for independent practice. The only option if you ever want to have independent practice is CaRMS. If you're okay with alternative routes, some provinces such as Manitoba, Saskatchewan, I think those are the only two, will allow you to be a clinical assistant or associate physician if you pass your exams here in Canada. So in Manitoba, you need to pass either NAC or the QE1. And in Saskatchewan, you need to have passed the QE1. Okay, so those are the only two provinces that if you did a 4-year, medical school program, you do not have internship, you do not have residency. That is the other option aside from CaRMS. It is actually a very good option for you to build your way up to having a better CV for CaRMS as well. So, if you can and you don't match in your first year, the best thing to do is to get a licensed clinical assistant position in Manitoba or Saskatchewan, for example, to try to stay as close as possible to practice so that you have a better chance at CaRMS the following year. Okay? The next category of people are people that did internship of 1 year or 2, depending on the situation, and let's start with did internship, but you don't have experience. So you did internship, but you didn't actually practice after, okay? So if you did internship, just as important as the duration of the whole year is the rotations, okay? A lot of people try to make a difference between internship and residency. Unless you're a specialist and you're applying for the PR, for family physicians or people applying for PRAs, it usually does not make a difference. They're both considered postgraduate training. What makes a difference is the rotations you have, okay? So for internship, usually people have a very organized transcript, very easy to know the rotations. If you did a residency, that might be a little bit more messy. So if you did a residency and you don't have a transcript yet with detailed rotations, you will have to do so, okay? You need a very organized transcript where you put exactly the rotations that you did. Now, a lot of people come to me and say, listen, I did a residency training, for example, internal medicine or family medicine back home, and I did not have scheduled blocks. It was everything. I was, doing calls every week. I was doing ambulatory every week, and I was also seeing the ward. And we would rotate in the wards in the morning, do ambulatory in the afternoon. At night I was on call. Like it was all mixed. How do I put that on the transcript? So the MCC and the Royal College, well, the MCC kind of like just a source verification of transcripts, but one common term that is used is called longitudinal equivalent. So what does longitudinal equivalent mean? If you were to look at a messy rotation like that or a messy program like that over the course of a year, how much time do you think, in terms of percent, did you do of ambulatory? How much percentage did you do of ward? How much percentage did you do of calls? Because that will be important for you to do what we call the longitudinal equivalent. So let's say that you did a 1 year of family medicine where you would go to the ward in the morning, ambulatory in the afternoon, plus you do some calls. And you had some rotations in OB, you had some rotations in peds. You're going to try to see more or less how many hours you had in the full year. So you're going to say, I was doing 60 hours or 50 hours a week, let's say, for 40 weeks. That's 200 hours, 2,000 hours. And then out of those 2,000 hours, you're going to try to see, okay, I think, 1/3 for sure was ward, 1/3 was ambulatory. And then out of the rest, I was kind of equal obstetrics, peds, and surgery, for example. So then you're going to write a transcript where you're going to put those 5 rotations, and you're going to put on top longitudinal equivalent, and you're going to put what would be the equivalent in weeks. So let's say you left with 100 hours for one of the rotations. We're doing 50 hours per week. That would be equivalent to 2 weeks. So you're going to put there 2 weeks of that rotation. Once you finish putting that transcript together, you're going to go back to your program director. And also, I get that all the time, which program director has to sign. It doesn't matter if this current program director, the person who was a program director at the time, or a head of department. Either they had a department now or they had a department at the time. Someone in a leadership role that has authority to assess the program or say that sign about your training. You're going to go back to them and ask them to sign that document and attest that that is true. Of course, only if it is true and they agree with it, then they'll sign. Once you sign that document, you source verify it. That is what you did. You cannot go back and change. So you need to think and reflect on what it is. Once you put it on paper and you get it signed, that is what it is. You can't apply to PRA in Alberta, and then they say you're missing one rotation. You go and you change your transcript to apply to Alberta, and then you change it to apply to Nova Scotia, because that's not how it operates, right? One thing is what you actually did. You're going to try to stay close as possible to the truth. And I say close as possible because it's impossible to do longitudinal equivalent and be exact. You're going to have, at some point, it is an estimate. Unless it was exact blocks, it is an estimate. But once you and the program director agree that that's the closest you can get to the truth, that is what it is. You can't change. So you need to think before you do it. Once you do it, it's final. Get it source verified. That is your transcript. With that transcript, plus your internship, that's what you're going to have in terms of postgraduate training to be able to apply for practice-ready assessments, or if you're applying for the PER as a specialist, that is what you're going to need. So just summarizing, if you have internship or residency training, and you don't have an organized transcript, that is number 1. You need to have a transcript that is extremely organized with the rotations, as specific as possible. You don't need to describe what you did. Okay, that's another mistake that I get. I've seen transcripts that are like 50 pages long. Nobody's going to read that. We don't care, oh, I was doing cardiopulmonary auscultation, palpation of the liver, blah, blah, blah. Like, nobody cares. Yeah, I want to know the name of the rotation. So internal medicine, obstetrics, gynecology. If you're a specialist, we want to know the subspecialty or the area of your specialty. So let's say you're an orthopedic surgeon, sports medicine or arthroscopy, hip and knee arthroplasty, the title of the rotation. You do not need to go and describe 300 surgeries of hip replacement, 140 hours of, like, nobody's going to read that, and it doesn't matter. Okay, it's too much information already for everybody, for you guys and for people that are assessing. So try to keep it as simple as possible. And just put the equivalent in either weeks or blocks. Block in the Canadian culture, 1 block is equal to 4 weeks. So in 1 year, they have 13 blocks. It's 12 blocks and 1 is vacation. 12 blocks of actual rotations. 1 is vacation. And that gives you exactly 52 weeks. Or you can just put months. So it doesn't matter. Okay? Now, once you have that done, the transcript, then we're going to look at the rotations. So each practice-ready assessment has different requirements for rotation. So that's where the MScCH book that I put together with, and after when I joined the MScCH for the short while I was there, it's the MScCH book now. It's has all the rotations there that is required for each of the practice-ready assessments, and we try to keep it up to date. So you can go in that ebook. It's free. You can download directly from the MScCH website. See what are first go to the table, the big table. See which one you fulfill in terms of the full length of the postgraduate training. And then after you meet the requirements there, you need to go into the specific section to see if you meet the requirements of the rotations. Okay? So each of the provinces have different requirements for rotations. That's the one I did not memorize yet, but it is there in the MScCH book. In terms of updates, and I didn't even put on my Instagram yet, that's coming this week, but I'll do it here and the people that are online on the live. Alberta changed a little bit their requirements for practice-ready assessment. So now to apply for a practice ready assessment in family medicine in Alberta, you need to have a registration exam, which is a little bit broad, what that means. The QE1 for sure fulfills that. NAC alone, I've asked, for sure doesn't. And USMLE partial also does not fulfill. So if you pass the step 2 clinical knowledge USMLE, it also doesn't, it's not accepted as a registration exam. If I'm saying anything wrong, please correct me. But they're looking at potentially, like there's a registration committee that might accept, for example, if you did the licensure examination in like the UK, Australia, or Ireland, they might accept that instead of the QE1. The website does not list which ones are the ones that are going to be accepted. So I suggest that if you're in that situation, that you submit your application or send them an email or contact IMG to try to help you find out if that registration exam is accepted or not. But going back to the requirements, you'll need one registration exam, which is the first of all of Canada to be a little bit not as specific. Like the others either require QE1 or NAC, and all of them accept the ones that require QE1. They always accept the 3 steps of USMLE to replace the QE1, but it has to be all 3. Alberta, with this new rule, might be accepting more than that, but we don't know yet. For sure, as far as I could understand, NAC is not required, and NAC alone is not enough. So in terms of Canadian exams, you still need the QE1. But they might accept other exams aside from the 3 steps of the USMLE. I'm trying to figure out which ones. I don't know that yet, but we're asking those questions to try to bring a little bit more clarity around that requirement. Now, aside from the registration exam, if you want to do a family medicine practice ready assessment in Alberta, Alberta now does not have a minimum duration of training that is required of the whole postgraduate training. What they do have is a minimum number of weeks in some specific rotations. So I don't remember at the top of my head, but I think it's like at least 8 weeks in family medicine. And then out of the other 4, which is peds, obstetrics, and gynecology, surgery, and internal medicine, you need to have a certain number of weeks in 3 of them. Okay? And then if you meet those requirements of the rotations and the duration of the rotations, it doesn't matter if you did 1 year or 2 years or 1.5 years or whatever it is, the duration. You need to meet. So there is going to be a minimum, because to meet the requirements of the rotations, there will be a minimum time. I didn't add up, but it's probably going to be around 1 year. And then outside from that, well, actually, that is it. They don't ask for experience, as far as I'm in the new rules, or the way that it is there on the website. Those are the only 2 requirements that they have, plus English proficiency and the currency of practice. And the currency of practice for Alberta is 1 year in the last 3 years. So it's the one that is a little bit more strict, along with, I think, Quebec is also a little bit stricter in terms of recency of practice. Okay? So a lot of people that previously were not eligible because they didn't have 2 full years, they might now be eligible for Alberta. If you fulfill these requirements, you need to submit all your documents to get your eligibility letter from the CPSA, and then you can look for a sponsor. MGA can help you. There's Doctors Alberta or something. There's a website also that has the positions that are available. And once you have a sponsor and you have your eligibility letter, you're kind of ready to go to get your assessment done, your field assessment, which is 12 weeks. Okay. So back to opportunities. So I talked about the people that only have medical school. Now we talked about people that have the postgraduate training with no experience. So Alberta is a good PRA opportunity. Most of the other practice ready assessments will require you to have independent practice experience. Exception to, I think, BC. No, not BC. Manitoba and Newfoundland. And Manitoba and Newfoundland and Saskatchewan. If you have 2 years of postgraduate training, Saskatchewan, Manitoba, and Newfoundland will allow you to do a practice-ready assessment even if you never practice independently. But it has to be 2 years of internship or residency. and meet their requirements for their rotations. All the other provinces, so now aside from Alberta, Saskatchewan, Manitoba, and Newfoundland, you need to have experience, okay? Now, the length of experience you need will vary according to how long was your postgraduate training. The shorter the postgraduate training, so if you did only 1 year, you usually need 3 years of experience. If it's 2 years of postgraduate training, in some provinces you can apply without independent practice. The ones that require independent practice will usually accept 2 years, okay? The only province, aside now from Alberta, that it might accept 1 year and no practice, the only other province that accepts 1 year is Saskatchewan, Ontario, Newfoundland, and Nova Scotia. For Saskatchewan, Ontario, you need to have 3 years of independent practice. And for Nova Scotia, and if I'm not wrong, Newfoundland, you need to have 2 years. They accept 2 years. So for people that have only 1 year of internship, you do have about 3 options, such as Alberta, Nova Scotia, and Newfoundland, as long as you have 2 years of independent practice. If you don't have any independent practice, I think Alberta now is the only option. Okay, which is new. That option never existed. It did? Yeah. No, but it was 2 year, but with 1 year of postgraduate training. Yeah, it's the first province that accepts 1 year of postgraduate training, no experience to go to a PRA. I think that's the because for every other province, if you have only 1 year, you needed 2 years at least of experience. So now, Alberta needs to add up the rotations requirements, but I think it's possible that if you did the right rotations, it should be only 1 year. I need to add up the requirements, the minimum. 8 and 3, plus there's one more. Yeah, which is how much? How many weeks on that one? 12? Yeah, so it's still, but I think it stays below 52 weeks if you add it all up. So it is possible that someone, if they did the right rotations, that they would have 1 year of internship and still be eligible for the practice ready assessment without experience. And that is a first in Canada. No other province with only 1 year of postgraduate training will allow you to go for a practice ready assessment. The other option for people who have only 1 year of postgraduate training is in Manitoba to do the MLP-IMG program. It's a residency program that is 1 year in duration, and it's only for people who have 1 year of postgraduate training and 1 year of experience. So if you have 1 year or more of postgraduate training plus 1 year or more of experience, you can, aside from applying to CaRMS, you can apply to MLP-IMG. It's outside of the CaRMS process. The residency program is 1 year in duration, and it also has return of service just like the other residency programs in Manitoba. They do give preference for people living in Manitoba, and even more preference for people that live in Manitoba and are already a clinical assistant. So if that is something that you're interested in, that's a good option as well. Okay, so we talked about that. In terms of family medicine, aside from the practice ready assessments, there is clinical assistant or associate physician. I'm a huge fan of licensed clinical assistant and associate physician because I think it keeps you close to medicine, and it is a huge stepping stone for people applying for CaRMS. Increases enormously your chance of getting matched if you are a clinical assistant, especially if you have a previous gap. So for people that are applying for CaRMS and you can't go back home because of a war or family reasons or financial issues, the second best situation is to be a licensed clinical assistant for at least 6 months to a year and then apply for CaRMS the next cycle. Because then you have good reference letters of people that actually saw you practice for an extended period of time in a position where you have a license, so you have responsibility and liability. The problem with clinical assistant positions in Ontario is that I've seen everything. There's no regulation. I've seen people that were basically cleaners in an office getting $15 an hour and were called clinical assistant, sweeping the floor. And I've also heard of people where the family doctor is not in the building and they're seeing all their patients by themselves, which is criminal. So I've seen both. So that's what happens when there's no regulation, right? That's what happens. There's no regulation, and that person, it's not their fault. I should say that. I mean, it's not the clinical assistant. It's their supervising physician that is at fault of allowing someone to give prescriptions and write on charts with their name when they're not present or supervising. That person is, doing their best. They might not even know how wrong it is, but that's the problem when it's not regulated. So in every other province, if there's an issue like that, the clinical assistant plus their supervisor, they both respond to the college, and they would have a very serious process of investigation to find out what was going on. So until Ontario becomes a licensed profession, whatever you do here, nobody knows how it can contribute to your CaRMS or to any other application. Any of the practice-ready assessments will not accept it as currency of practice. And for CaRMS, you're going to have to try to build your case on an interview, but it will be open to interpretation. Some of them might accept as being, okay, cool, you were practicing. Some of them might say, I can't know what you were doing. So it's a really, too risky in my opinion. So my suggestion is always to try to get a licensed clinical assistant role or associate physician role. Most of the options are outside of Ontario. So for those living in Ontario, all of the options of licensed clinical assistant or associate physician are outside of Ontario. The two provinces that hire the most is Alberta and Manitoba. The other provinces really, some of them have the license and never issued a license, such as Prince Edward Island. They have the license for, I think, 2 or 3 years. And I think they're yet to issue a license, if I'm not mistaken, or if they did, it's like one of the advisor of them. They're also the only province that has a license for clinical assistant and a license for associate physician. Every other province, we use that term interchangeably. It's the same thing. But in Prince Edward Island, they have 2 different licenses. But they also they don't have jobs. So if you're really interested in that, the 2 best provinces to look for positions is Manitoba and Alberta. Not only they have more experience, they have more job offerings, they're more regulated, salaries are better, everything is more organized and more, yeah. Sorry, can you speak louder? Like if you don't have permanent residency, you mean? So if you're a refugee or if you have an open work permit, you're usually able to be hired as associate physician or clinical assistant. To be a clinical assistant, out of the top of my head, you know better. 1 year postgraduate training still? Yeah. Yes. So for the clinical assistant, it's still 1 year. For the PRA, it's not. Is that the situation? It's still 1 year. They didn't change it. And just a tip for, yeah. For more than 2, actually, right?
So as long as, you could be up to 2 weeks before your
Oh, yeah? I thought it had to be 1 year in the last 3. Is that for clinical assistants? Sorry?
As long as you've arrived in, Canada, and you haven't practiced, as long as you're within the 3 years,
Okay.
then you can apply.
Okay.
Okay, but once your 3 years expires,
You need 1 year?
then you need the 1 year. Yeah.
Oh, okay.
So it's as long
So,
as
sorry, one is currency, the other is recency?
yes.
Yep, the 3 years. Is that for PRA and for clinical assistant? Oh, yeah. It's when you submit the application?
They were good.
Okay.
I got the eligibility.
So it's when you submit the application. Yeah. Up to 3 years. Okay. So for the people that are not listening, I'm just going to repeat the question and what Deidre just taught us here. So for Alberta, if you're applying for practice ready assessment or clinical assistant, you need, so there's two. The first thing is if you arrived in Canada, yeah, so as I understand it is that you have to have practice for at least 1 year sometime in the past, and then once you arrived in Canada, you have 3 years to start your process in Alberta. If those 3 years expire, to be able to do the process again, you're going to have to work 1 year continuously. Is that correct, Deidre? Or it doesn't have to be continuously? Yeah. Okay, yeah. If you guys can let me know at the end, I'll update everybody. The one thing that I saw, and you can maybe feedback to CPSA, is there's like a quick flow sheet that still hasn't been updated. So they changed the PRA in one side, but they left it, the flow sheet says QE1 mandatory, but now it's registration exam. Anyways, I'll show you later. Okay. Yeah.
Graduate training. But because they didn't do, let's say the pediatrics exam,
Yeah.
become a pediatrician,
Yeah.
then they would be ineligible, and that's always been the case. So it's, you need the postgraduate training, plus you need to have done the national exam, and sometimes some.
For specialty though.
Yes.
Yeah.
So then you have to work to get, to basically have the correct documentation.
So you do need to have a certification from back home. Okay.
From an approved jurisdiction.
Yeah.
From anywhere.
But you need to have the certification. Okay. That is different for the PER route, because the PER route you can apply without the certification. So that's what people get confused. Yeah. 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 PRA. Yeah. Yeah. Okay. Okay. Yeah. Okay. So for people that are online or on Zoom, if you're doing a practice ready assessment as a specialist, what about for so for family medicine they say the same, but if you practice as a general practitioner and you were issued a license, but there is no exam for that back home, they accept a license. You either have to have practice independently. Okay, but for specialists, you have to have practice and done the certification exam. Okay. Yeah, so if you're doing a practice ready assessment as a specialist in Alberta, you need to have done a national certification exam back home. No, the years is different. So the years is they do say that it has to match the Royal College standards, but I don't know if they do like the PR, it has to be exact. Do you know that?
And you say internship also?
Sorry?
It depends. They do consider that the
Internship
special.
also.
Yeah, but you have to work.
Yeah.
Because in Ontario it's 5 years, right?
For what?
For the PRA specialist.
We don't have PRA specialists. PER is all the whole country. It depends on the specialty. I can talk about that later. It's very complex. PER is different. Yes. Yes. Or you're a specialist, right? I'm going to get there. I'm sorry. We deviated a little bit. I'm talking about specialists, but you can ask during if it's what I'm saying, but if it's something that I'm going to talk about, so like if you're a specialist and it is about the PER, for example, I'm still going to get there. But if it's about practice right assessment or Alberta, please ask now. Yes, did you? So that's if you break. If you arrived in Canada and you didn't practice at all, but it's within 3 years, so you didn't reach 3 years yet, you're eligible for Alberta Clinical Assistant Associate Physician and PRA. If you expire the 3 years, to be ready again, you need to go back home or do postgraduate training for a period of 6 months if you're going to be an associate physician, and for a period of 1 year if you're going to do practice right assessment. Okay, I got that. My memory now. Sorry, yes. Sorry, just, yeah. Yeah. Yeah.
First internship, maybe 1 year of independent practice.
Yeah.
So it means I'm eligible for both the clinical assistant position and then PRA.
Not PRA, but
She might be. She did 1 year of internship. Depends on the rotations.
Yeah.
In 2024, that would be still within the 3 years. Depends on your rotations. If your rotations meet the requirement, so yeah, so I can't go into the nitty-gritty, but lay out your rotations, and then at the end, or we can talk, or you can meet with them, and they can help you. But if you have the QE1, you need to pass the QE1, you need to have the right rotations, do the English requirements, you might be able to be practice ready assessment. And I think in Alberta, you can find a sponsor with a work permit for a PRA. Yes. Okay. Yes.
For Alberta, do we need to be living there for a long time, or?
No, for practice ready assessment and clinical assistant or social physician, no. If you're applying for CaRMS, there's 3 options. Either you did 2 years of high school there, or you did 2 years of postgraduate education, or you lived continuously for 24 weeks. Yes. Do you guys know if the 24 weeks is at any time, at any point in life? It has to be that specific 24 weeks? So there's a specific period. So if you're going to apply to CaRMS, you need to move and stay there until. Oh, okay. I didn't know that. So for people that are online, if you're applying for CaRMS in Alberta, you can submit your application now, I guess, like before the deadline, but you need to be in Alberta continuously, living there between December 1st and May 15th. So book your tickets, because Ontario doesn't want you at this point. Yay! Yeah. Yeah. Okay.
For those who have been graduated from different specialty but have some rotations in the different specialties,
Yes.
like gynecology, for example.
Yeah. Yeah.
And also have that 1 year of internship during the medical school, plus post-graduation training that they receive multiple rotations. Does we accept it as a family physician PRA? Or?
Yeah, you can apply for practice ready assessment, but you need to have the currency of practice, recency of practice. And yeah, but you can. So there are specialists that do practice ready assessment in family medicine, because they can't become a specialist here, but they have all the rotations requirement to be a family doctor. You can do a practice ready assessment as a family doctor. Okay. So let's move on again. So we talked about people who have postgraduate training and no experience. Sorry, we talked about people that have medical school with no postgraduate training, no internship, no residency, no experience. Then we talked about people who have just internship or 1 year of residency. We talked about people for family doctors that have 1 or 2 years of experience and 1 or 2 years of training and experience. And we talked about practice ready assessment and clinical associate physician positions. Does anybody have any questions about these things that we talked? So anything related to applying for general practice or family medicine, practice ready assessment for family medicine or general practitioners, clinical assistant, associate physicians. Any questions about that? No? I can't see the questions online. Yes.
Than other schools, we have 2 years of internship.
Okay.
Does that change things for the practice assessment?
You might have longer rotations, which might make you more eligible. And also in practice ready assessments where Alberta is different because it's an ongoing system and you got to find your sponsor. But for programs like Nova Scotia or Ontario or BC, where it's a program and they select, there's a competition and they select a small pool of people, the longer training you have, the more competitive you are. So having 2 years for sure helps. And also, aside from Alberta, if you have 2 years of training, do you also have experience or no experience after that? No? Okay, so aside from Alberta, if you complete 2 years of training of internship, you can apply without having experience for a practice ready assessment as well in Manitoba, Saskatchewan, and Newfoundland. So those 3 provinces accept 2 years of postgraduate training and 0 experience, plus Alberta. Okay, but you do need to have the QE1 in Alberta, Saskatchewan, Newfoundland. You need to have NAC for Saskatchewan and Manitoba. So Saskatchewan needs both QE1 and NAC. Alberta And Newfoundland, you need to have, sorry, Newfoundland also needs both, QE1 and NAC. Alberta, only the QE1. Manitoba, just NAC. Sorry? Yes, in those four, as long as you have the exams. Yes. So after you have your eligibility letter, then you can work with IMGA, or you can go, there's a website, I think it's Doctors Alberta or something like that, that has all the positions that are available. And then on the description of the positions, you'll see if they accept, if they do sponsor, or if they accept to be a sponsor or not. So if there's an opportunity for sponsorship, it will be on the ad. And then you apply as you would apply for any other job. If they like you, they submit, they let the CPSA know. The CPSA will have your eligibility letter. The CPSA put the two together and make the magic happen. You go for it and get your job, okay? Well, you get your assessment. Then you're assessed for 12 weeks. And then if you pass your assessment, then you get a provisional license. And the return of service is 3 or 4 years? Oh, for the return of service? Is there a minimum or a maximum or no? I thought it was provincial, like the CPSA requirement. It's a sponsor that. Oh, yeah. Okay, but is there an average like 3 to 5 years? Yeah, minimum. Yeah. I was gonna say okay. I've heard. Okay. Yeah. So they pay CPSA? Oh, I didn't know they have to pay. Like the assessor is not the person who's hiring. They need to pay for a separate external assessor to go. Oh, so the assessment is not done at the clinic that is actually gonna but so the assessor is not the person who's gonna be, like, is not someone in the clinic necessarily. It might be, and it's an external buy from Alberta, from the CPSA.
Other than the.
Oh, I get it. Okay. Okay. Yeah. 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 Yeah.
They say, you know, we're willing.
Yeah.
And they do it based on, is there a specialist in internal medicine, for example, needed in this area? If
Yeah.
it's yes, then they could say, yes, you can have a sponsored position, and they have a limited amount of time that they actually have to find someone to fulfill that.
Oh, okay.
Otherwise, then they have to.
Apply again.
request.
Okay.
So, and then they're subject to costs. You can't charge the individual that you're hiring, but how they recoup those funds is through the return of service.
Okay.
Yeah, so that's, but they.
And then during the return of service, does the person have to pay back? Okay, but they can't get like part of the billings or stuff like that after. Because I've heard sometimes they keep like 30% of your billings or something like that for a period. Yeah. Yeah.
Goes to the individual.
And 30, okay. That's
And
the
it's
okay, they recoup. Yeah. Okay. 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 Any other questions here before we move on? Because then I'm
Yes.
going to talk about specialists next. And then we can talk a little bit about CaRMS after.
Thank you very much for the invitation and good morning, everybody. I have two questions. Number one, I have international experience as disaster management, emergency management for more than 25 years. I got master from Italy. My background is physician. Then I took master from Italy in disaster medicine. Also, during my work as a disaster officer, I was also working as triage physician at ER for around 17 years. I have experience also as instructor in all first aid courses, advanced life support courses, all kinds of those courses. Also, I was chairperson of environmental safety team inside the hospital. So what do you think? What is your advice for me if I
What did
can?
you do for a postgraduate training
What
after
is
medical
what?
school?
What my medical is? I have baccalaureus in medicine
You have
from
what?
Syria.
Sorry?
Baccalaureus. I
Bachelor's,
am
yeah. So you have your medical school and you said you did a
yeah.
master, but was the master's a residency program where it was
Master
clinical
in
100% of the time,
disaster
or was it research based?
Master in disaster medicine from Italy.
I understood that. I'm asking some countries, masters mean residency program. In some countries, it means research. And in some situations, it's only course based.
Okay,
So
thank you
what
very
was
much.
your master's?
This is a good question. Actually, I took master blended program. I made some module online, and I attended a few weeks there in Italy. I had to travel there. There was
Okay,
thesis.
so
I
yeah,
prepared
that's
thesis.
not a
There was
postgraduate
exam.
training. That's not considered as postgraduate training, like clinical training here. Did you do any residency or internship?
No, no, I am newcomer. Still, I am newcomer.
No, no, no. Back home in Italy,
Yeah.
did you do any postgraduate training, such as internship or residency training,
No,
accredited
no,
residency?
no. Because
No.
I took the master while I was at working. I was working in Saudi
Yeah.
Arabia. Yeah.
So you finished medical school and you started working and you worked for 25 years. Is that what you're saying?
Yeah, I had experience for a long time, 20, more than
No,
25
I
years.
understand your experience. I'm asking about residency or any training. After medical school, you didn't do any more training.
Only triage physician in ER.
Okay. And your medical school in Italy was how long?
I told you I'm give instructor. I give training for all
No,
kind
no,
of.
no. I'm
Yeah.
asking when you did medical school, how long was medical school?
My
5, 6, 7?
6 years in Syria, Aleppo. 6 years.
Okay. Did the 6 years include internship or no?
Yes, 1 year, the last year.
Okay. So you can use the last year of your medical school as postgraduate training. And then
Mm-hmm.
you have experience. We need to look at the rotations you did on that last year.
Mm-hmm.
And when did you last practice?
Uh, during
How
my
long? When was the last time you worked in Italy or anywhere else in the world?
yeah,
At a
last year,
specific.
last year I just resigned from Saudi Arabia and I entered here.
Okay. So you're against the clock. You have basically a year or so to pass the
Yeah.
QE1, do your English proficiency examinations, get a transcript of your internship, get everything source verified, and then you need to look at the rotations of the 1 year of your internship. And based on the rotations, you might be eligible for Alberta, Ontario, Saskatchewan, Nova Scotia, and Newfoundland. One of those provinces for a practice ready assessment. If you have more
Uh,
questions, you can go to the MCC website, download the ebook. But the key solution for you, the piece that you didn't understand that you need to understand, is that the last year of medical school can count as internship, but you're going to have a medical school transcript, and it has to clearly state on the medical school transcript that it was internship. Without that 1 year of internship, you have no option here aside from doing residency. So you need to go after that 1 year of internship, get it source verified through the Medical Council of Canada as internship or as medical school transcript. And then you can use that internship to apply to practice ready assessments. Okay?
okay. Okay, thank you very
No
much.
worries.
I appreciate your time. Thank you.
Okay. I'm going to move now to specialists. So do we have specialists in the room? I have one here. Anyone? Two? Anybody in the back? No? Okay. What's your specialty? Sorry?
Laboratory medicine.
Okay.
Yeah, laboratory.
As well. Okay. Anybody else? No? Okay. How is it called here? Is that on the Royal College?
Like,
On the Royal College as a primary specialty? Okay. I don't remember that as a primary specialty. And is it on the list of the ones that accept internship? No, I don't remember that as a primary specialty on the Royal College. I'll look at it after. Right? No, there's pathology, but okay, I'll look after and we can look together. But okay, so for specialists, you have a few options. The best option currently is the practice eligibility route. So the practice eligibility route is a process with the Royal College. It's not linked to any province. And the route was designed for you to go through it from beginning to end, from not being eligible to even write the exams, all the way to writing the exams and becoming certified. Becoming certified by the Royal College means that you get the actual certificate, the piece of paper with your name, that is the certification, and you can use the letters FRCPC after your name. Now, that is what the PER was designed for. What happens is the provinces that give the license, each province can use pieces of that process to make decisions on who they're going to give license to. Because in Canada, each province can do their own thing, right? So Alberta, for example, does not use the PER process. They don't look at that. They have their own process. They have the practice ready assessment for specialists. They do not use the PER process. All the other provinces, except Quebec, uses somewhat of that process depending on where you're at. So well, not me. The Royal College splits the PER process in three. So it's three phases. The first is getting eligibility to write the exam. So that's when you apply to get eligibility. To apply to get eligibility for the PER, you do not need to have English proficiency exams. You do not need to have PR. You do not need to be recent to practice. They only look at the training. They don't want to know if you worked. They don't look at your experience. Nothing else matters aside from anything that is actual training. They look at all your training. So they look at internship, residency, master's, research-based, course-based, as long as it's full-time, PhD, and even MBA if it's full-time in some situations. Now, that doesn't mean that you will be eligible, but they look at everything, and then they compare to what they have established as the Canadian standard. So the Royal College has a standard for each of the specialties in terms of what the training needs to be. That standard, it's called Specialty Training Requirements. So there's a document for each specialty on the Royal College website called Specialty Training Requirements. That document has all the rotations that are needed. And if your training, when you add up everything you've done, from internship to everything else, if it fulfills somehow that requirement, those requirements that are outlined there, you get the eligibility. It is mostly time-based still, so you need to have a minimum number of years, but then they look also at the rotation. So just having the same number of years doesn't mean necessarily that you're going to be eligible. One of the main mix-up that happens is that a lot of people think that internship will always count, and that's not the case. So only, I think it's 14 specialties accept internship. And within those specialties, they also look at the rotations you've done. So I had people come to me and say, I did internship, but it was 6 months surgery and 6 months obstetrics gynecology. Unfortunately, that internship might not count for most of these 14 specialties because they might be looking at sometime in internal medicine, sometime in surgery, sometime in peds, etc. So you need to look at the specialty training requirements document to see what is the requirement of usually it's the first year, to see if your internship can be counted. And you need to see if you are one of those 14 specialties that accept internship, okay? With the PER, it's important to understand that residency is the main part. So the bigger chunk has to be residency, which means that unless you have at least 3 years of residency, you're unlikely to be eligible for the PER. Now, aside from the 3 years, you can add sometimes, depending on the specialty, internship, and then you can also add the other stuff, such as master's, PhD, clinical fellowship, research fellowship, etc. It might be able to be added, okay? So I'm going to talk about the two specialties that are here. That's one that I never did anyone. So I need to look at the requirements and we can look it up together. General surgery, I know it's 5 years. Does not accept internship. So you need to have 5 years of training. But the good thing with general surgery is that the last year, so the 5th year, they're pretty flexible on what it can be. So it can be master's, PhD, clinical fellowship, research fellowship, MBA. They usually accept almost everything for the 5th year. But you do need to have 4 years of residency in general surgery. The other cool thing is that if you did 3 years of general surgery and then you did a subspecialty, because I get a lot of people that do like plastic surgery or whatever, they did 3 years of general surgery, you did 1 year of subspecialty, and then you did 1 year of fellowship or a master's, it might work. We need to check the specialty training requirements, but you might be able to use the subspecialty training plus the 3 years of general surgery plus 1 year of fellowship, PhD, clinical fellowship, or whatever. Okay? Less than 3 years of actual residency, impossible to get PER for general surgery. So at least 3 years in general surgery. Okay? A lot of people, including people from Brazil, general surgery is 2 years, then they go to subspecialty. You're not eligible for PER general surgery, unfortunately.
And the rotation of general surgery during 1 year, you have some rotation in other specialties. For example, for gynecology and obstetrics, for you go for anesthesia.
Yeah.
Do they count the only general surgery rotation, or all of them is counted as 1 year of general surgery program?
No, hold on. So the residency is general surgery, but then they look at the rotations you did, and then there's going to be rotations of actual general surgery, and then there's the other rotations you need to have done. So you need to meet, but the Royal College says it needs to be substantially equivalent. So what that means is that if you're missing one rotation that is 2 weeks in duration, or for like 1 or 2 blocks, as long as the whole time is similar, they're usually going to accept. But if you're missing something critical, such as, for example, the common things that I get as a problem is people that do gen surg never done endoscopy. That might be a problem. You might need to explain. People that did, for example, anesthesia and never did obstetrical anesthesia. That is a big, you can't get eligibility to be an anesthesiologist who never did obstetrical anesthesia. So it depends, if it's a big chunk or something critical, it will be a problem. But if it's a small rotation, so for example, it says that you need to have 3 out of 4 electives, or 3 out of electives in a whole list, and you have 2, and you don't have a third, and it's an elective, and they probably, as long as the overall thing looks good, they usually will give you eligibility. Okay? Aside from the PER, so if you have the PER, then we can look at what provinces and what to do after you get the eligibility. So once you become eligible, you have an email that says you're eligible to write the exams. That means that you have 5 years to pass both components, the written and the oral. You can take each component up to 4 times, but you need to pass both of them within the 5-year window. Okay? Once you have the eligibility, with the eligibility alone, you can apply for a license, as long as you have a job offer as well, in New Brunswick and Nova Scotia. If you have the eligibility and the QE1, or you have the eligibility and you practiced back home as a specialist for more than 5 years, you can also apply to Newfoundland and Prince Edward Island with eligibility alone. Okay? Let's say that after you got the eligibility, you took the written exam and you passed the written exam. Aside from the provinces that I already mentioned, the 4 in the Atlantic, you can also apply for Ontario and apply for a restricted license. So if you got the eligibility and you passed the written exam, and you have a job offer, you can get a restricted license in Ontario. After that, but you do need to have the QE1 in Ontario. Okay, so you need the QE1, the eligibility, and the written exam. Let's say that you passed the written and the oral, but you still are not certified, because to be certified, you need to pass the written, the oral, and work in Canada for 2 years. So you don't have still the full certification, but you already passed the written and the oral. You can apply for jobs in BC, in Saskatchewan, Manitoba, Ontario, all the Atlantic provinces.
And
as long as, sorry, as a specialist with a provisional license. And then it depends, the QE1, you might or might not need it. So in BC, Manitoba, and the Atlantic provinces, in New Brunswick and Nova Scotia, you don't need the QE1. In Newfoundland, PI, Ontario, and Saskatchewan, you need the QE1. Okay? Yes.
I have a question. For PER eligibility, at the beginning, they ask for the medical certificate.
Medical school
medical
transcript, yeah.
school certificate or diploma, specialty certificate, and post-graduation training transcript.
Yeah.
These can be source verified by physician apply and IMG.
Yeah.
But 2 liter of the which you got from your post-graduation director or from your that you have.
Which letter? The CANMED?
Attestation letter and a rotation schedule that you will receive from them cannot be verified through the physician apply because it was crystal clear told that these kind of papers cannot be.
So the CANMED's letter, you don't need to source verify. With the attestation, you don't need to. The Royal College will not ask for that. The CANMED's letter, the attestation, you don't need to source verify that. The rotation schedule, that's the same as transcript. You can submit for source verification as a transcript.
Well, but physician apply do not accept that for the rotations.
If it's a rotation schedule, has all the rotations, start and end date, the duration, and it's signed by a program director, they will accept as a transcript. As long as it has all that information. So it needs to have the rotations, the duration, when you started, say that you were a resident, when you started, when you finished, every single rotation, the duration of the rotations, your name, letterhead, signed by a program director. If you submit it, they will accept.
Because different countries have different rules. For example, in our country, the transcript is given, but the rotation is not exactly as written that this rotation for this week, this rotation for this week. It's only said that the year of graduation name, earth of date of birth, blah, blah, and also the 5-year, the numbers, the scores, and the.
That's why you need to make one. That's what I was saying at the beginning. You're going to have to create a transcript. You can't use that one if it doesn't have the rotations. You're going to have to create a document and go after your program director to sign it.
But the physician apply accept as a post-graduation transcript.
Sorry?
Source verified has already been, mine has already been source verified.
But if it doesn't have the rotations, it's no use for the PR process.
We make the rotation separately and got to the.
Then you need to submit that as a postgraduate training as well. But you need to have all the rotations and then they will accept as a postgraduate training document. Postgraduate training transcript. So you need to do a separate one. Unless the one you have and you submitted is detailed enough, you can use that one. If you didn't, you're going to have to do another one. Now,
the other one which shows the details of my rotation, all of that.
but when you say details, do you mean the name of the rotation or what you were doing on the rotation?
No, the name of rotations,
Okay.
the dates, starting
Yeah.
date, finished date, and the total number of the months.
Yeah. Then you can submit that to the MCC for a source verification. Yeah. Sorry?
Can I give directly to the Royal College?
You can. And then you can see if the Royal College is going to ask for the source verification or not. If they ask, then you're going to have to do the source verification after. Yeah.
Verified by MCC.
Yeah.
They will not accept any certificate which is not verified by MCC. I'm in the same way right now. My documents are stuck there.
But they will accept if it's on a letterhead, has the name of the rotation, start and end date, signed by a program director, they will accept as postgraduate training, they'll source verify it.
My back country.
What country are you from?
Does not accept its own standard transcript.
No, but you're going to talk to the person who was the supervisor of your program. You're not going to go to the government. You're going to go to the university. Who was the chief, the head of department, or the program director, someone who's going to sign?
The government.
No, you put the information of the director, and they will contact that person. Okay? Okay. Just to finalize, so after you get a job with one of those provinces, as I explained, with eligibility or the exams, you need to work for 2 years continuously in the same place. And then after you work for 2 years continuously in the same place, you pass both exams, you become certified. You get the paper of the Royal College, you become FRCPC. After you have FRCPC and you have the QE1 and or full LMCC, or you pass the 3 steps of the QE1 of the the 3 steps of the USMLE, you can be licensed in any province in Canada. Okay? So that is the last step. Now, aside from the PER, the other process is a practice ready assessment. There's only 2 provinces currently, or 3, because one of them is Quebec, but I don't talk about Quebec, that does practice ready assessment for specialists, okay? So it's Alberta and Manitoba. They're pretty similar in the initial requirements and the process somewhat, I would say. You need to submit first to the CPSA or to the College of Manitoba all your credentials to get an eligibility letter. And after you have the eligibility letter, you need to look for a sponsor. The difference, I think, is that in Manitoba, you can only start the process with the Manitoba. They only look at your documents to see if you and give you a eligibility letter if there is a job opening in that specialty at the time. In Alberta, you can get the eligibility letter and then you can go out to look for jobs. In Manitoba, you need to at least have a job opening. There needs to be an existing job opportunity in your specialty for you to be able to request an eligibility letter. And then once you get the eligibility letter, you go back to that employer, that job opening, and apply for the job. Okay? Practice ready assessment in specialty is different than family medicine, can be 12 weeks up to a year, depending on where you are. Once you pass that initial clinical assessment, then you'd need to do return of service, which can vary between 3 and 5 years. And during that period, sorry, just let me finish. So once you finish that, during that period, you become eligible to write the Royal College exam. Even if you weren't eligible by the PER route, you can become eligible through the PRA route. Once you write the Royal College exam and you fulfill 2 years working in your return, even during your return of service, you become certified. And after you complete your return of service, you pass your exams, you're free to go anywhere in Canada.
Is it 5 years even in Alberta for PR specialists?
For the return of service?
For PR specialists?
For return of service or postgraduate training requirement?
Graduate training required.
4 years, she was saying. So it depends. Yeah, I think they might accept 4 years. That's what it's saying. Yeah. Manitoba might as well accept 4 years as well. Okay. But usually for a practice ready assessment specialist, also in Manitoba, you need to have done some sort of certification exam back home. For the PER route, because it is a process to become certified, so you're going to do their certification exam, they accept people who haven't been certified abroad. But Alberta and Manitoba, they're relying on some kind of certification of another body, and they're not going to certify you. So you need to have completed a certification exam back home. But for the PER route, if you did the training and you didn't take the certification exam back home, you can apply to take the certification exam here. That's what that route is designed for. So that's why they accept without you having done a certification, and the provinces usually don't. Okay? Yeah.
For PER and for practice ready assessment route for specialists, continuity of the practices necessary on the theory or not? For example,
for you to apply for the PER process itself, it's not. But when you apply for the provisional license, it is required that you have currency or recency of practice, and then it depends on each province what are the requirements. But most of them will accept if you have practiced 6 months in the last 3 years. That's the most common one. But we talked about Alberta and how they do it, but it's most common. Okay. The last final option I just want to talk about for especially for people that are online, is that you can apply if you have enough of if you did fellowship, you have a master's, PhD, you're doing fellowship here, academic license might be an option. That's what I did. And Alberta, Saskatchewan now recently just started academic license. So BC, Alberta, Saskatchewan, Manitoba, Ontario, Nova Scotia have academic licenses. And you don't need QE1 or anything for academic licenses. You just need a job at a university and you need to be at the rank of assistant professor or higher. So if you're a lecturer or instructor, it doesn't you can't get an academic license. If you're a assistant professor or higher, then you can get a academic license. And the last final option that I like to talk about because it's very unique is New Brunswick. If you did 2 years of fellowship in Canada, even if you're a subspecialist or you're a specialist that would not be eligible for PRA or for PR, but you did 2 years of fellowship in Canada or the US, Canada or the US, you can apply for licensure in New Brunswick. That's the only province that has that exception, and it has been the gateway for some people that, or otherwise, I had a cardiologist from Brazil that did 2 years of internal medicine and 2 years of cardiology. She couldn't be eligible for PRA in Alberta because she didn't have at least 3 years of internal medicine, I think, or something like that. It was a minimum requirement. She was not eligible for the PR in internal medicine or cardiology, but she did 2 years of fellowship at the University of Ottawa, and she got a job in New Brunswick. So now after 2 years working there, she can write the Royal College exam in cardiology. If she passes, she can work as a cardiologist anywhere in Canada. So it's a good entry for subspecialists, especially if you have a fellowship of, if you've done 2 years of fellowship in Canada. Okay. Final questions. I think I'm running out of time. Anybody else? Any questions? Yes. Yep.
For the PRA, so you need just 1 year of.
No, you need to have the rotations now. So you need to look at the rotation requirements. And I do not have them memorized, but we can look it up as soon as I finish. No. I'll look at the requirements after, and I'll look at your specialty training requirements. Okay, thank you, everyone. I cannot look at the questions here, but if you live in the GTA, can you apply in Alberta for PRA? Yes. PRA for family medicine, do you need certification where you finish? You need either the certification or you need to have worked as a family doctor independently. Okay? Okay, thank you, everyone. Let me get out of here. And thank you for everyone on Zoom. Thank you. Yeah, if you guys have additional questions, I have a few, like 5 more minutes. I'll do yours and yes, and I'll try it. But I need to leave in about 15 minutes.
Okay. My certificate, baccalaureate in medicine, was recognized by WES.
What certificate are you talking about? Sorry.
My certificate, medical medicine, baccalaureate in medicine was recognized by WES. Does that make any
No, it
difference?
doesn't count. It has to be through the MCC.
Okay. Thank you.
Thank you. Yes, who has questions? Okay, everybody, we have very few minutes. So I'm gonna allow first the people who haven't asked yet. So, yeah.
I want to ask about documents verification for MCQ or decision apply.
Okay.
Are there any preferences for any document over another? Like, is it better to verify internship or medical degree?
Well, it depends what you're gonna do. The medical degree is usually the first step. So you need to do the medical degree. And then after that, if you're applying for practice ready assessments, you're gonna have to do the internship as well.
So for the MCQ, I need
For them to write the MCQ, the QE1 exam, you just need the medical degree. You don't need the
or
internship.
the bachelor transcript,
Sorry?
the medical degree transcript.
Just the medical degree certificate is enough for you to write the QE1. If that's your goal, just the medical degree certificate. If you're gonna do more than that after, such as apply for practice ready assessment or depending on what you're gonna do, then you might need to do more documents. If you just want to write the QE1, just the medical degree is enough. Okay? What's your question?
Other research experience, but not like masters or anything like independent researches and applications. Does this like make any difference in practice assessment?
Practice ready assessment? No. But if you're applying for CaRMS, it might help you on your CV. Yeah, all that helps for CaRMS. For the practice ready assessment, usually that doesn't matter. Okay? What's your question?
I have done postgraduate diploma in pathology and bacteriology.
Mhm.
way back in 2003 to 2005. And I have done it for 2 years. I have passed the exam.
Was 2 years in duration? Okay.
Yeah, so that is considered residency. But do you think there is any scope here with that kind of
Did you
experience?
do senior residency after? No, you're not gonna be able to get anything. You can do associate physician in BC, or associate physician BC, Alberta, any of the other provinces as an associate physician, but if you want to be a specialist, you're gonna have to redo your training here. You need to go for CaRMS.
Question.
So you didn't do laboratory medicine, or you did just that one?
I've done that, like postgraduate diploma in pathology and bacteriology.
Okay, yeah, that's would be microbiology here, not laboratory medicine. But you need to have 5 years. So even though it accepts 1 year of internship, you have 1 year of internship, 2 of residency, you're not gonna meet the requirements for practice right assessment or for residency. It's too short.
Secondly, I've done a diploma in community worker program at George Brown. So, like, it was done in 2018 to 2020.
Hmm.
Does that give me any added edge on the public health background?
As an alternative profession, maybe, but not in medicine. Or if you're trying to look for jobs as a independent practice physician, it's not gonna add.
If I, yeah.
Sorry?
If I put that in the CV for public health,
For CARMS.
residency for CaRMS.
Oh, for CaRMS, yeah, it might help. Everything that you put on CaRMS is a CV. They're looking at you as a whole, so everything counts. So that might be an option.
My last currency of practice year was 2022 November, and I'm applying CARMS second iteration in December, like next month. So there'll be 3 years of exact gap of. I'm working as a clinical assistant since last 4 months, but it's not a licensed one.
Yeah.
So
If you get an interview, you're gonna have to, and they ask about the gap, you're gonna explain, but it does make you less competitive. It's really hard to match with 3 years of gap. Not impossible. I've seen people match with big gaps, but it is unlikely. It's just not. If they have someone that is as good as you with a smaller gap, they're gonna usually give preference to that person. So my suggestion to you is that after this cycle, you either go to a province where you can be a licensed clinical assistant, or you go back home for 3 to 6 months and practice and then come again.
I have almost 8 years of experience in pathology working. I have a post graduation of 3 years. Also, I have a Royal College degree from UK.
It's all excellent, but you've been out of practice for 3 years.
Researches.
Yeah. So I'm saying you're competitive. I mean, you have your application. I'm just
It
saying,
will be good for the pathology. Right?
I'm just saying if you don't match this year, it's very much probably because of the gap. So if you want to have a better chance next year, instead of staying here and trying the same thing again, try a different road, because the same road is going to lead to the same destination, which is not matching. So if you can try to match, you have a chance because it's 3 years and you have a very good everything else. But they might not give you the spot because of your out of practice. So then if that's the case and you don't match, my suggestion to you is either become a licensed clinical assistant, but if you can, even better if you go back home and practice for 3 to 6 months. Especially because you're gonna have, are you applying for pathology? Yeah.
That's a story. I have a background from
Yeah.
that, so.
Yeah, the problem is now pathology, even the spots are now only whatever is left on second iteration, right? So competition is gonna be a little bit higher. So that's again, I'm trying to see, so for yours is not laboratory medicine, yours is actual pathology?
Yes, general pathology, but I'm looking for diagnostic and diagnostic and laboratory medicine.
Let me
There are
just see.
4 sports, one in.
Oh, it's diagnostic and clinical pathology. We don't have laboratory medicine. I knew that. Okay, it's the name, just the name is different, but I know there was nothing with laboratory in it. There's two, one is called diagnostic and clinical pathology. The other is diagnostic and molecular pathology,
I'm looking for diagnostic.
which is like more,
Histopathology.
yes. Clinical pathology is more lab,
And,
yeah, okay.
Look for they apply there and then. Masters.
Master's where, sorry?
Then I agree.
ILB, what is ILB? Oh, oh, okay, yeah, yeah. Yeah, that would help your application of CaRMS for sure. Okay, here.
For when you apply for the PER route, then you give the documents for assessment. If there are some concentration or some comments about the document, they give you a chance to explain or to?
Yeah, they
react
communicate
or
back and forth.
just-
They usually tell you what it is. If it's something big, like you're missing a full year, or you're missing 6 months, they're gonna issue the letter saying that you need, to fulfill. But I've appealed many of their decisions, but usually before the decision, if there's something that they didn't understand, they'll usually send you an email asking for clarification, like how can you explain these rotations, how you did it, etc. Then after if they need more information, they'll ask you everything they need. Like, I need a letter for this, I need a letter for that, or what was this rotation? They'll talk to you. After they finish their assessment, they make a decision. If you don't agree with the decision, you can still go back. I've reverted now, I think 4 or 5 of their decisions, like appealing. So for my clients. So I usually get a client that I do privately outside of my help that I help everyone. I do private consultations, and then I've had 4 or 5 people that came to me and I was able to revert, but there was also like 2 or 3 that I usually know if I'm going to be able to be successful or not. And then I usually tell the candidates, I've told some of them that there's no chance and they just didn't apply. And then there was one I told him he had no chance. He said, I still want to do it. I said, I can help you, but it's like very unlikely they're going to revert. And they didn't.
What's the most points that there should be any chance for being accepted, for example, the big issues?
Minimum number of residencies is the biggest one. If you don't have that number of residencies, they're not going to accept. People that want them to accept internship, if it's not one of the 14 specialties listed, they won't accept. So
General
that's,
surgery, do they need the internship?
they don't accept internship.
They
So
don't accept or
they do
don't
not
need?
accept.
So sorry to interrupt. We're wrapping up here. We're
Yeah.
going to the pipeline spotlights.
2
Okay?
more minutes, yeah.
Sure.
So they don't accept.